We now commence a press briefing by Prime Minister of Japan. Today, we would like to avoid a crowded situation. We have ample interval between reporters. So when you make a statement and ask questions, please wear off your masks. First of all, there's a remark by Prime Minister Abe, followed by a question and answer session. With that, floor is yours, Prime Minister. Today, 4 prefectures in Kanto and 3 prefectures in Kansai, including them 39 prefectures, will be delisted out of a state of emergency. Why we did this? We heard opinions from the experts and cooperation, infections trend and medical readiness, and the monitoring regime, and those are the 3 checkpoints, including specific numbers were the base. And those criteria has been set versus 2 weeks ago. And 1 week ago, new infections are coming to decline. That's a trend, and the recent 1 week, less than 0.5 head per 100,000 people were infected, and untraceable infections. And these are the numerous items that we have taken into consideration. In view of these criteria, 39 prefectures need to be conducted cluster measures completely so that we can contain outbreak, and that's the situation we are right now. The critically ill, its numbers are coming south, and testing regime and medical readiness are sufficiently functioning to monitor the new infections. Dr. Omi and all the members of the advisory panel have given us the consent, and we pulled up these schedules much earlier, and effective today, 39 prefectures will be lifted in a state of emergency. We have a task force meeting after this press conference. We will approve this. A remainder of 8 prefectures, we need to see the new infections that need to be significantly dropped, and ventilators are necessary for critically ill. But those patients who are needing those ventilators are coming to decline by 60% in Tokyo, Osaka, but we still see the risks. We shouldn't let down our guard. We need to stay indoors, and that's a cooperation we need from people. And move to countryside and suburban area should be avoided as well. 1 week ahead, 21st of May, once again, by that time, we will hear opinions from the experts. In view of the criteria we set today, if possible, we don't wait for 31st of May, we will cease a state of emergency for those remainder of the prefectures. Devoted efforts by medical professionals, thank you so much. Because of these efforts at medical sites, the people discharged and recovered from the coronavirus topped to 10,000, over 10,000. Overwhelmed the medical site and medical institutions are started to be relaxed on balance. Approximately 700, we had the top number of infections across Japan, but every single day it slipped below 100. Over the immediate 1 month, it slashed below to 1/7. This is a result that we gain from each and every Japanese people's cooperation. Thank you so much from my bottom of my heart. In many regions, because we lived a state of emergency, this point on, new daily lives with coronavirus need to be recovered. And we need to really get going, and today marks the very start. The restaurants and department stores and arcades stores, cinema, and museums, those cultural entertainment facilities, public transportations, hotels, and Japanese inns, over 80 sectors by sector based on the advice from experts because of the guideline versus COVID-19 has been formed, because we need to make sure to protect the medical professionals, and we want to see to it that consumers were relieved to utilize the services and its facilities.
On the regions that have been lifted out from the list, we'd like to ask them to take reference of this list to start restoring their business operations, and we'd like to work together to build our new future, daily lives. However, any guideline will not reduce the risk of infections to zero. After the lifting, we still have the virus around us. Hokkaido, at the end of February, they had their individual declaration of emergency, and they have succeeded in suppressing greatly the number of infections. However, since the lifting in mid-March, since 2 or 3 weeks past that, they have seen an uptrend again. In Germany, right after they have relaxed their outing restrictions, there are some areas that had to return to a lockdown from the increase of infections. And in Singapore, where they were initially successful in suppression, we have seen infections growing and surging. And in Korea, last week, I think you remember that the news was reported that at bars, infections have surged. So once you are caught off guard, we see a surging of infections in an instance. And this is the most terrifying part of this virus. In order not to, in fact, slush down the drain our past efforts, I have 3 things to ask for to all of you. First is to have staging of reopening businesses and the economy. We're not asking for the prefectural residents of the lifted areas to restrict their outings, but if possible, please limit your close contacts by using telephone and other means. And amongst the areas that have been lifted or delisted, at least for this month to the extent possible, please refrain from crossing prefectural borders. Therefore, staged restoration of daily life is what I'd like to ask for as number 1, the first thing. And the second, the change that we are in right now, we'd like to also continue to have you adapt yourself to the new way of living. Telework for the last months has become more prevalent. So what we can improve on, we need to continue to work on it. And we'd like to go forward with this forwardness or positive advancements we have seen, as well as telework is in fact effective for reducing congestion on commuting. And third is that in every daily life aspect, please stay on the alert to the virus. Please wash your hands frequently, of course. And please take ample distancing with people, avoid crowds, and also wear masks whenever you go out. And to the extent possible, avoid coming in close contacts. And also avoid confined spaces and choose spaces outside instead of inside. Therefore, please refer to the new guidelines for new lifestyles to avoid the 3 C's in every way you can in your daily lives, especially the 3 C's that overlap the entertainment districts at night or nightlife outings, going to live houses as well as bars and entertainment facilities, please refrain from going out to those locations ongoing. Please protect yourselves, and I would like to remind you to do so, especially. To restore our full economy, while doing so, at the same time, we need to suppress the expansion of inspections of this virus, which is a hard challenge. More than ever, we need each and every one of you to cooperate with each other. The virus being in the spaces that we live in, we need to the extent possible, control our infections and to try the best to restore our daily lives. The new lifestyles, over a certain period of time, we will try out and establish the new ways of life, which we believe are necessary. And in everywhere in the world, however, there is no given answer yet of what would perfectly assure you and protect you. And we will see a prolonged period of this continuing. And if so, of course, we need to protect our livelihoods as well as our jobs as well. And in doing so, together with our people, we will take every step of the way together. And in doing so, we believe, and in our judgment, we believe it's necessary to take further strengthened measures. The 117 trillion supplementary budget, in order to add upon that, immediately on part of the government, we will go into compiling the second supplementary budget. At the headquarters meeting right away after this meeting, I will give instructions. Those who have actually been idling their businesses in order to protect their livelihoods, we will have fundamental additions to the subsidies and cash handouts, which was daily 8,000 yen. That would be per day as a special measure raised to 15,000 yen per day.
And especially, this is a system that designed each employee can apply and directly they're given those money. And that's the system we are going to establish. There is no end in sight for ending pandemic. This current situation transcends all of us individually. This is the one crisis in 100 years. Even the major giant companies have taken hit by coronavirus. But successive bankruptcy should be averted. From big to medium to small and micro SMEs need to be financed, and we need to enrich the system. And should it prove necessary, an agile manner, the capital need to be financed to buttress the sustainability of the business. SMEs have more latitude of 2 million, and that finance will be approved, and the finance will be provided, and that starts the 1st of May. And the situation and the process will be streamlined, and we will start sending money. Over 80,000 SMEs and the self-employed were provided of the 100 billion yen. The financing, the end of the month, need to be gone through, so effective free interest and no collateral and 5-year moratorium for principal repayment will be supplied by those businesses to accelerate the current economy. And based on the current situation, the coronavirus fight is long-lasting, and new benefits will be established as well. And anti-infections measures need to be put in place, and up to 1.5 million Japanese yen of new benefits will be added to those SMEs. so that we can help strongly and boost the recovery of those companies. And the local government's anti-infection measures will be cooperated and enriched through local governments. And we work together with the local governments to curtail the next wave of COVID-19. In case that occurs, we would like to downgrade that waves. So we would like to have an airtight operation. If the doctors think it's necessary, we will promptly execute the testing. Yesterday, pharmaceutical approval has been given to antigen test, its kit, and this is a new silver bullet. This antigen test have been conducted to many of Japanese people, and this is a new the system the same as flu. Unlike the PCR testing that taking 6 hours, but only 30 minutes is necessary to find out the results. So we can find out whether the people are positive or negative. If the virus volumes abound, there is a good results we can get from antigen tests like PCR testing, so that we can detect the infected people as soon as possible, and this will read the results. 20,000 to 30,000 worth of the kits of the antigen test can be provided next month. Combining with the PCR testing, speed and volume-wise, we would like to enrich and buttress the testing regime. Utilizing saliva, we would like to commercialize the testing regime. From the deep of the nose, the mucus has been detected, but unlike those systems, we can alleviate the burden for medical professionals, at the same time increase the efficiency and volume of the testing. We resort to any possible means so that we can ensure to conduct the testing and the people can receive testing if the physician think it's necessary, so that we can contain the outbreak of COVID-19. As a medication for critically ill, remdesivir, this is one of the anti-COVID-19 drugs, were secured for necessary numbers, and administration has been already started. And again, once the promise can be found out, that we would like to give approval this month. And Fusan, Actemra, ivermectin, those possible medication are the drugs we find out in Japan. As a medication, we also found out the side effect. On the basis of these side effects, we will administer and dose those drugs. And clinical testing is on the way. And as soon as we found out the promise against this infectious disease, we would like to give pharmaceutical approval. There are varied strengths among those drugs, so we would like to combine a mix of these drugs to yield the results. We need to avoid an explosive infections. We would like to make it small. We need to make infection slow, and we need to push back those infections waves so that we can have a solid regime against COVID-19. And always there is a risk and threatening situations of the next wave by COVID-19. However, the opening economy really need to get going. Obviously, that entails the elevated risks, but the future is 2 weeks ahead, goes down to the wire. If we let down our guard, it's very much possible that we again declare a state of emergency ahead. That's why we are showing why we are doing this today. But once we gain cooperation from the public of Japan, we can avoid the situation. The end of February, schools were closed altogether, and massive events have been held back. at the request of the Japanese government. I know this is a suffering to Japanese people, but as a result of it, the first wave of infections by China have been under control. Genome analysis of NIID shows that results. Again, thank you so much for your cooperation.
And for the last months or more, owing to all your efforts, the second wave from Europe and United States is in the process of being suppressed. And per population, the infectious cases as well as the death toll per population amongst the G7 advanced countries is outstandingly low and contained. This is objective evidence backed by figures. This is all the outcome of a nationwide effort of all our nationals. I believe all the nationals are having a hard time from the constraints in their daily livelihoods over a prolonged period, and it would be very stressful, as I could easily imagine. But we see steady progress from our past efforts. At this time, we are trying to prevent further spread of infections, and we'd like to fundamentally change our lifestyles. And we are in the process of developing our new life model or mode of life, which is a very tough challenge. And however, though this is a challenge with the cooperation with our nationals, I'm confident that we are definitely going to overcome this. Thank you. So we will go into questions. Prime Minister Abe and Dr. Omi will be answering those questions. We are asking the Prime Minister to move to the seat and the table position. And please raise your hand, and once you are given the go, please go to the microphone and state your affiliation and name in asking your question. So please, starting from a leading media outlet. I'm Ogawa from Sankei newspaper. Thank you. On the emergency declaration. In Ehime Prefecture, we have seen a new group infection of 17 cases. Ehime is included into the 39 prefectures that have been included in lifting. What was the most critical judgment criteria of why you have included Ehime amongst the 39 prefectures? And for the remaining 8 prefectures, please tell us how you are making judgments on this. And also in Europe, we see a rise in infections after a relaxing of restrictions. And as Prime Minister has mentioned, we can't completely rule out the risk of infections, and that would also apply to the prefectures that you are to lift the prefectures, to lift the declaration today. And what are your measures that you will take if we see a resurgence and in fact, there are, amongst the 39 prefectures, if you see some of the prefectures coming back to the list, and in the case that you see the 8 prefectures left that could not be delisted, what would happen? The 8 prefectures that are not delisted, I'm asking the residents to endure the prolonged period. But it's true that we are seeing progress even in those 8 prefectures. At this moment, we must stay alert, and we'd like to ask for the cooperation in refraining your outings. And if possible, for the remaining prefectures, if it's possible, we'd like to lift them from the sanctions, if possible, before the expiry at the end of this month, the 31st of May. However, as I've mentioned, in fact, until the vaccine or therapeutic measures are established, we will see a prolonged battle with this virus. there is a potential that this virus will be brought back in, of course, from overseas. Even if in domestic prefectures we have contained and suppressed them, so we need to seek continued cooperation as well on that point as well. And after the lifting of the declaration in some prefectures, or the 39 prefectures, without citing examples from overseas, once you relax, you will see a surge of infections again. And we have to share that understanding amongst all of us fully. And the emergency declaration, if it's going to be redeclared, we have also given the criteria if that is needed too. On this occasion, it's very important to absolutely avoid 3 C's to develop a new mode of lifestyle or pattern of lifestyle. As I've mentioned, trying to restart our businesses and at the same time trying to suppress the virus infections from spreading is, of course, a tough challenge. But nevertheless, we will have to cooperate, each and every one of us. And also, we have asked all sectors to cooperate in actually formulating the guidelines. And so we'd like to continue steadily on cooperation. And my responsibility, of course, is first and above all to protect the lives and health of our people, as well as to protect their livelihoods and jobs. I am resolved to steadily and try to fulfill the best in my capacity those responsibilities. And in doing so, I'd like to also remodel the patterns of our new normal lives. And in preparing or bracing for the potential danger of the spread of infections again, I'm part of the country, and we would like to also steadily fulfill my responsibility and the government's responsibility as well. The next question, please.
Sato from Hokkaido newspaper. You forewent 8 prefectures for state of emergency, and they were devastated economically, and you said you were compiling the supplementary budget, and you also mentioned the benefits. And for instance, support for school children and the benefits for business continuity and the schemes to back rents. Is there any specific you can disclose today? And even in this situation on SNS, many celebrities were against the revision of the Public Prosecutor's Office Acts. The 3 state powers were impaired by this revision. Don't you have any plans to forego this revision? And it's possible that its positions will become the Superintendent General, but how do you see that? Well, first of all, when it comes to its size, we were going to have a task force meeting, and we will give instructions to compile the supplementary budget in which we will discuss the size and scale. And its size, it's anybody's call at this point. But we need to have enough and ample size of the magnitude against COVID-19. And we would like to hear opinions, not only ruling parties, but opposition parties, and employment adjusting subsidies. And there were some challenges of the upper limit, and 15,000 yen per day is something we want to elevate to. This is the highest in class, and we need to support school children and students who are doing part-time job. We need to support them financially, and as I said outset, and SMEs need to be buttressed financially, and big to SMEs need to be underpinned drastically by the Japanese government at this point, so that everybody need to be relieved by this compilation of the budget. And support was delayed for some companies, and we heard those complaints, and we take it very seriously, so that we can resolve the bottlenecks, so that with a sense of speed, we need to execute these measures apace. and the revision of the Public Prosecutor's Office Act. National public servants are related to this topic. As Japanese government, as you know, currently we are fighting against coronavirus and we're doing all we can in our power. But in the Diet sessions, plenty of the bills were discussed. Not only that topic, but pensions and all the bills were discussed. As a Diet session, as a legislative branch, we need to fulfill that responsibility, in which the schedules need to be decided by the Diet. And the revised bill on the Public Prosecutor's Office, why we're doing this? Because we need to capitalize on expertise and experience by the senior officers. That's why we will raise the retirement age for public servants. That's why we are applying it to the public prosecutors. And in the first place, and they were administrative officers. So the state of power, separation of powers, they have a strong independence, but they are an administrative branch. And now the cabinet will appoint, which is a strange, people say. But to begin with, traditionally, the Minister of Justice and the cabinet were supposed to do so. And the cabinet will certify. But other than that, the Minister of Justice will appoint. And this is the practice we have observed so far. So there is no possibility to mar the separation of the powers. And that's not something that's coming to occur. And personal decisions were not decided, of course. And I'm not the one who should say so and make any comments that will impair the powers, so I'm not going to do that. We would like to make efforts so that the people can deepen their understanding of what's going on.
So, other than the leading media outlets, we will accept questions. Please raise your hand. I will appoint the reporter that will ask the question. When called, please advance to the microphone and ask your question. We have many questions at each meeting, so please limit your question to one per person. Please, Shigeta-san. I'm Shigeta from Nikkei newspaper. On the lifting of the emergency declaration in Tokyo, we had 30 new cases today. On top of Tokyo, Chiba, Saitama, and Kanagawa have yet to be delisted. So if Tokyo is the last to be delisted, is it an option that the 3 other prefectures will be delisted earlier, or is it all combined together? The lifting, of course, is based on the experts' opinion and panel, and the advisory committee, in fact, has decided on this lifting, and therefore more in detail Dr. Omi will explain, but in this criteria includes neighboring prefectures, and the situation in neighboring prefectures is written. In Chiba, we have seen substantial decline in new cases, however, it's closely connected to Tokyo. For the metropolis of Tokyo, compared to some while ago, we've seen substantial decline in new infection counts. However, another point is that in providing medical services to patients, we have seen a substantial rise in patients being discharged from hospitals. As I've mentioned earlier, less than 100 have been reported as new cases, but recently 300, 470 patients per day have been discharged most lately. Therefore, we've seen a substantial decline in hospitalized patients, and most naturally, of course, substantial portion accounts for Tokyo. And also, we will have to consider the cluster formation potential, and I'd like to yield here to Dr. Omi. a prefecture, is it possible that any surrounding prefectures of Tokyo could be delisted earlier? But on the criteria that we have proposed at this juncture includes, of course, the medical capacity, as well as infectious counts, as well as testings, regimes. And the other point that needs to be considered is that no single prefecture is carved out as a single prefecture, but it's closely connected with neighboring prefectures altogether. In all one unit is what we have proposed as well. The next question, please. Please raise your hand if you have a question.
それじゃあ星野さん。
Hoshino-san. This is Hoshino from Asahi Newspaper. The revision of the Public Prosecutor's Office Act. In the Diet session, you said the schedule is in the hands of the Diet, you said. But the Article 59 and the list of the lower house and the revision and the erasable were set. The set by the cabinet were stipulated, and you haven't gained a consensus of the public for the revision. Is there any plan for you to delist from the act as a whole? Well, again, the topic that discussed in the Diet is in the hands of the Diet. That's a political process. And I was used to be the Secretary General. And in the politics and Diet, the party needs to be responsible for that. Of course, we sometimes consult with the party. And my words were consistent. And going forward, we continue to make effort to gain cooperation from the public.
いただきます。はい。
Next question, please. The second from the back, wearing glasses and a mask, please. I'm Ito from Radio Nippon. Thank you for this opportunity. Treatment, drugs, as well as vaccine development. What kind of support are you giving on part of the government to this right now? Infectious diseases. When we saw an outbreak of infections of the coronavirus, the novel coronavirus, we have been focusing on vaccine development in Japan. In G7 and other fora have also actually called for collecting world wisdom on this. Remdesivir, where we have seen trials between the U.S. and Japan, we have seen special fast-track approval just recently. And we have already seen doses being administered. And we already have secured the doses enough to cover patients already. And for Abegan, close to 3,000 cases, in fact, that have been monitored. We have seen administered cases, and we have seen advancements in clinical trials. And once the efficacy is approved, we'd like to aim for the approval within this month. And Dr. Omura, the Nobel laureate, ivermectin that he has developed, it has been used for parasite diseases or skin diseases. And very soon in Japan, we will see, in fact, it being administered to treatments under observation by doctors. And once efficacy is proven, we'd like to approve on a fast-track basis to provide these drugs as early as possible to our people. As I've said up front, the drugs, of course, can be combined together to be greatly effective when combined together, especially. And in that sense, we need to be agile. And on vaccines, global suppression, of course, vaccines can be a great part of that. In the United States already, trials have been started, which is administering to patients at the National Infectious Diseases Institute, as well as at the University of Tokyo and in Osaka University. We've seen administered cases already. And at the earliest in July, we may see, in fact, that further advanced. And through CEPI and other organizations, together with international, Gavi included, organizations we'd like to move forward in collaboration.
テレビ東京の篠原と申します。
Shinohara TV Tokyo. In your statement, you said the infections per population and death tolls were lower relatively versus G7s and amongst the Japanese people. Well, we are doing that because the BCG has been injected and maybe the differences of culture, people say so. But what's your takeaway? And what differences drive those gaps versus other G7 nations? Well, correlation with this COVID-19 infections and BCG. I know there were many theories. In Japan, the death tolls per 100,000, that's 0.5. It's significantly lower versus other countries. I know there were many pros and cons, but that needs to be supported opinions by the Dr. Omi. But whatever the case is, current infections, this number of people have been claimed its lives by COVID-19. We would like to extend our sincere condolences. But we are able to contain these infections versus other European countries. And then we would like to continue to get it under control. Well, first of all, BCG vaccination. There is no scientific evidence that BCG has a promise. And the gap, why we have a gap with other countries? Why? One, the medical system in Japan has been relatively solid. I wouldn't say everybody, but most of them have been treated and properly treated in hospitals to contain outbreak. Second, especially at the initial period of infections, cluster measures were very effective. And third, this is most important, presumably, but awareness for health are relatively higher. And those are the 3 points that generating gaps.
Next question, please. Matsumoto-san. I'm Matsumoto from NHK. Thank you. On the Special Measures Act, which is not, in fact, imposed, but rather voluntary, there are also various views on how it could be further improved. And this autumn and in winter, we will. There are concerns that we may see a wider spread of infections. And Prime Minister, you've mentioned that at any time we may see a next wave of infections spreading. Do you believe the current Special Measures Act is sufficient in containing the next wave? And we need to also assess the structure. I believe once you get settled, from when are you going to reassess the law itself? As you said in the question, the Special Measures Act is voluntary and is not as strong in imposing it compared to West Europe and in the United States. Clusters, of course, to a certain extent, have been suppressed in nightlife entertainment districts at night. And we've also seen substantial reduction in outings. And this is all because of the cooperation that we have so far from our people. And amidst this, on the special measures law, how could it be evaluated, I think is their question. when we see the infections subsiding going forward, do we need a further stringent laws that impose constraints on people or not should be revisited? And if necessary, we may have to consider revising or strengthening the law. And we would like to actually lower the peak to actually be within the capacity of our medical system to the extent possible, to flatten the curve. And in doing so, we are developing treatment drugs as well as vaccines to enable that. Medical workers, of course, have been striving to their utmost capacity. ECMO, for instance, and other medical devices, to the extent possible, have accommodated the hype so far. However, of course, for the next waves, we need to flatten the curve as much as possible, but further we need to enrich or enhance the medical capacity as well. And in order to do that, to delay any peak or spiking, we are trying to actually develop vaccines as well as treatment drugs as fast as possible, as well as their approval. The next question, the very back, the person who has raised the notebook, please.
インドネシアの新聞記者なんですけど。
This is Richard Sealed from Indonesia. The state of emergency has been lifted now, and after which various measures will be launched, I expect. International mail. 1st of April, and since then, international mail. Over 146 countries, including Indonesia, service has been halted and mails can be sent. So as a one foreigner, I know a post office is something I need to be grateful for. So that's very important facility. And international mail, is there any plan to open that service again? Well, international mailing service. Through air, cargo will be utilized. And one more air freight will be utilized. But Indonesia, airplanes are the sole means. There is a little flight. That's why we couldn't continue the enough service. But from Ministry of Internal Affairs and Communication has requested reports from post office, but that's the situation underway. So for time being, it might be challenging to reopen that service. But as soon as possible, we would like to continue to and recommence the service. And the other day, the Prime Minister of Indonesia, Mr. Joko, myself had talks, and we would like to work hand in hand to overcome the difficulty. In Asia as a whole, this anti-COVID-19 measures need to be cooperated. The center's establishment is one of the agenda I proposed, and PPE, personal protective gears. And we requested Indonesia to supply those PPEs, and we would like to join hands with Indonesia to overcome this difficulty.
The next question. Shiura-san. I'm Yoshida from Kyoto News. Thank you. The new mode of life, or the new lifestyle you've mentioned, including the prefectures where the declaration will be lifted, continual efforts, of course, are essential to prevent widespread infections. At the same time, we see ample spacing or distancing between people at this conference room, and wearing a mask when meeting each other. This new lifestyle, there's a new question arising of when this will end or not at all. On part of the government, are there certain situations that could be achieved to do away with all of this, or going back to the old style of life? Or do you have any targets that you are showing or trying to indicate here, if there are any? The novel coronavirus, with regard to this, vaccines and drugs are very critical, which are decisive. And if they are decisive in their efficacy, we can overcome globally against the coronavirus. And that situation should prevail. However, until that situation could be delivered, as well as the United States, as well as Europe, as well as in Japan, though we do substantial decline in cases, we may see an uptick in cases at any time again, of course, when relaxing restrictions. So to avoid that, we need to change our way of living. In the 39 prefectures that we're lifting the declaration this time, however, we will see staged lifting within those 39 prefectures until the end of this month, the 31st of May. And in doing so, we will try out ways and solutions to come up with any improvements if possible. Of course, we have a strong sense of feeling that we would like to go back to the past lifestyles, but unless or until a drug and vaccine is developed, we need to stay alert to take one step at a time. However, of course, we can surely say that Japan is on the path of suppression and containment. And as a result, we have seen some vacant capacity in hospitals and the medical system. However, we will continue determined to take every measure possible. The next question, please.
Imai-san. This is Imai from Yomiuri newspaper. The school admission in September. And some of the prefecture will continue to be under a state of emergency, and there is a gap in the context of education. Some people say it's ideally to enter kids in September, but somehow we can secure some enough time to study. How do you see that admission for school in September, and by when would you like to make a call? Well, school admission in September. To begin with, the Educational Revitalization Council will discuss that. The school admission in September. Looking at the other world, many parts of the world has a system designed to enter kids in September in schools, and many school kids come into Japan and vice versa, and some people were out of company and going to schools again. And there were some objection in my party as well, still. But anyhow, we need to secure the opportunity for learning for kids, and we need to resort to any possible means to maximize the opportunity. By seizing a state of emergency and the situations around the resumption of the schools, but not only schools, but the consequences against society need to be seen, and there were many options on the table, including school admissions in September. Much earlier than you might expect, we would like to study that option. Of course, we shouldn't be cavalier in the discussions for that possibility, and how that should be also need to be examined. But we would like to have in-depth discussions, and that's a discussion taking place in ruling parties as well. Next question.
Yoshino-san, please. I'm Yoshino from Asahi TV. Tokyo's exit strategy is my question. You mentioned 3 judgment criteria, and we believe somewhat Tokyo is going to be the last to exit. Tokyo, we still have a stretched out medical system, and on top of the 3 that you've mentioned, the hospital bed numbers as well as reproduction numbers, Do you have any idea of further giving criteria to actually hang into achieving those goals? On this juncture, in lifting, I've mentioned one of the criteria is medical capacity as well as monitoring is second, or PCR testing, for instance. To what extent we have it. Of course, it's a fact and true that Tokyo still has some challenges to PCR testing. We are going to have further strengthened capacity of PCR testing as well as antigen testing. That would be enabled by the strengthened structure or the reinforcements in Tokyo. Hospital bed numbers as well as the patients discharged. I think it's important to track them very closely. And to the Tokyo Metropolitan Government, we have urged them in many ways to do so, which is also very essential. The effective reproduction number. Tokyo, of course, has substantially been below 1. It would be around 0.5, is it? Or it's below 1 and around 1.5 at this moment. So Tokyo, as a metropolis, there are specific factors in many ways, but by taking that also into account, in a week's time or in 2 weeks' time, we will further have a expert reassessment. If, of course, they meet the criteria right now, we may consider lifting this. But I will yield to Dr. Omi. Of course, not limited to Tokyo, but our criteria that we propose to the government is especially on the infectious cases or infections. The most important is that for the last week, how is it compared to the past week? And also to have at or below 0.5 to a population of 100,000 is a yardstick, but not just that, but also effective reproductive rate or number, as well as if we can establish routes or not of infections is also important. And also, how much capacity allowance do we have in receiving serious critical patients? And also how much bed occupancy rates could allow receiving or administering mid to less severe cases, which are also important. ECMO, for instance, as well as ventilators and other equipment. Tokyo has been closely tracked on how they're doing. And in regard to the yardsticks that Dr. Omi has mentioned, in 2 weeks' time, we'd like to consider or revisit this issue. This is the last question, please. The woman at the very end row, please.
My name is Azumi, freelancer. You mentioned second supplementary budget. There are issues that can be resolved by money. For instance, with COVID-19, after which society dynamics will be changed and the people will close the business with enough cash. Of course, for middle-sized companies, Chinese capital might be injecting capital to those companies. And those foreign exchange acts say there are some protections for big companies, but middle-sized companies cannot be guarded and protected with these foreign capitals. But these companies underpin the whole Japanese economy. This is a treasure of Japan. Are there any measures on the table to protect those companies? Any policies, any measures to protect the future of ours? in order to establish a society living with COVID-19? Well, first of all, in the listed companies, we're protected by the foreign FX law. Thinking about national interest, and strategically, we would like to take actions, and we would like to keep tabs on the trend to serve our national interests. And among the middle-sized companies, there were many great technologies are established, and many scores of companies have the great supply chains. Of course, though they support and undergird the Japanese economy. Then from other countries, those companies shouldn't be pounced on by the other companies overseas. But basically, we are one of the member states of WHO, so without any reasonable reason, we can't protect it. We can't forestall it. But there were some challenges on supply chain and daily necessities and essentials. For example, in the medical field, need to be created and manufactured more in Japan. That's my hope. And investment destination need to be diversified and shouldn't be heterogeneous. But what counts is to sustain the businesses of SMEs, and this is the area we would like to focus more moving forward as well. With that, we would like to close the press briefing by Prime Minister Abe. Thank you very much for your cooperation.